Welcome to the Nightingale Project, a project that's been pulled together by 11 inspirational ward sisters and their matrons. It's about making our ward environments less stressful, improving our patient experience and our staff experience by building in a little bit of standardisation that means that we never forget both the big and the small things that we need to do each day. But the Nightingale Project is also about enhancing the way our teams work, valuing every single member of the team, from the small things about introducing each other at the start of a shift to making sure that also everybody leaves together on time. This video outlines the 4 key stages in achieving consistency of care during the first hour, the mid-shift and in the last hour, and considers the human factor skills in healthcare, including self-care, non-verbal communication and team working, that supports these communication episodes.
Hi, my name's Sarah, I'm nurse in charge of
The Nightingale Project team have created a vision and pledge which we've all signed up to. The aim of this is for all the MDT to work together to have the right skill to deliver the care at the right time for our patient and carers. This is underpinned by the trust values and the circle of care model for human factors in healthcare.
On the night shift, and I'm going to lead the safety briefing for you.
Safety briefing is led by the nurse in charge of the outgoing shift to all the staff on the incoming shift. So that's all the nurses, the nursing assistants and any students that might be on the team. So the check-in is an opportunity for all the staff to introduce themselves to each other so everybody knows who they're working with on that shift.
Nurse, I'll be working with Grace. Hi Hannah, welcome to the ward.
And also highlight any areas that they might need support with. So for example, a newly qualified nurse might need support in medicine competencies. It's also an opportunity for everyone to talk about their allocation, so which patients they're going to be looking after on that shift. The nurse in charge of the incoming shift should introduce themselves to the team so that everybody knows who is in charge of the shift and where they should go if they've got any problems. It's also a time for the nurse in charge to let the team know if they're going to be off the ward for any length of time, for example breaks and meetings, and allocate someone to cover for them during that time.
Leaving the ward at 10 and at 2:30, so in my absence.
So the idea of the briefing is to prioritise safety, so that's looking at any patients that have any risk factors, for example falls, and any other issues that might be going on in the ward that all the staff need to be aware of for that shift. The briefing should be brief, a maximum of 15 minutes to allow people to go on to their handovers. So at the safety briefing we talk about the trust bed state and also the ward bed state. It means that we can work towards timely discharges so that patients waiting in A&E or theatres are moved on to beds as quickly as possible. The safety briefing should make sure that people are aware of the times that their break should be during that day so that they can support each other to cover the ward during that time. We talk about safety messages from the trust, so we have safety signals which are messages from the medical directors team, and we also have more local messages. At Guy's and St Thomas's we have the Big 4 which allows 4 key messages to be shared with the team. So the safety briefing should be interactive and it's an opportunity for staff to raise any concerns that they might have or ask any questions to the nurse in charge. At the end of the safety briefing we arrange a time that the team will regroup at the mid-shift huddle to check in.
Hand over a few of the observations and things.
The bedside handover allows the staff to introduce themselves to the patient and review the records and medications with the outgoing nurse. S stands for situation, which is patient's name, age, diagnosis and reason for admission. P stands for background, so the background to their admission. A is for assessment, where you state the key risk factors such as falls. R stands for recommendation, stating the plan of care and the relevant physical, psychological and social aspects of your patient. After bedside handover, it is important to undertake bedside safety checks. This includes bedside equipment such as the core bowels, oxygen and suction to make sure that they're properly working and to ensure that patient safety signs are up.
Welcome everybody, welcome to the mid-shift huddle.
Mid-shift huddles are a way to improve communication amongst all team members. This should be very brief and should take place once in a shift and should be pre-arranged and prevented from any interruptions. It should take ideally maximum 10 minutes. The purpose is to enhance situational awareness of all activities on the ward for the nurse in charge and the rest of the team. This would help promote effective team working, improve communication, and also improve patient experience and the quality of care that we deliver.
Are up to date, so I can cover for Claire while she goes for a break.
Research has shown that huddles improve staff satisfaction and decision making on the ward.
Oh, I'm all right, that's great. I keep on about it, I know, but it's very...
The last hour is a practical guide to help staff structure their last hour of a 12-hour shift. The bedside nurse should check in with each patient and carers or family, review observations and update e-noting, complete time-critical medications and flag any patients they have concerns about. During the last hour, the nurse in charge may need to consider reallocation of staff and will gather the latest information to create the incoming team's safety briefing. The nursing assistant plays a vital role in the team. They may be more freely available to respond to patients' needs and visitors' queries and to settle the ward in readiness for the shift change. For a safe ward, it's important the team are all able to share concerns freely, be able to ask for and receive help, and have awareness of each other's status in terms of workload. Through standardising the way we work, we hope to improve situational awareness and create closer working teams to support continuous safe care 24 hours a day, with the outgoing staff leaving together and on time.